Hey everybody, welcome back to the Digital Health Entrepreneurship Show with Laurence Girard. This is a fun show because we actually have one of our physician investors joining us on the show. Thanks so much for joining us, Ari Bernstein. And to start, could you just give us some context for who are you and how long have you been involved with Fruit Street?
Yeah, sure. Thanks for having me on. I really appreciate it. I'm Dr. Ari Bernstein. I'm a board-certified internal medicine physician. I also have experience in emergency medicine, hospitalist medicine, some clinical research, and genetic research. I grew up on Long Island, New York. I first met Laurence about 4 or 5 years ago because we both grew up on Long Island. We talked about his vision, about how he thinks he could change the healthcare system using technology. And right away, I bought in, I saw his vision. I thought it was the future of medicine, and I knew I wanted to get involved.
That meeting at that Starbucks, I remember, before we had an office.
Changed my life.
Likewise.
How do you remember Laurence pitching to you? Or give us a little context into that Starbucks meeting.
So at that time, there weren't a lot of investors yet, but Laurence had the big vision in his mind. And really all he needed was that vision and to act on that vision. And by creating that vision in his head and giving it to other doctors, that's all it took for other doctors to buy in and invest into the idea. Because at that time, there wasn't the technology yet. So we couldn't invest into the technology. We're investing into an idea. And we all had the same idea of wanting to improve the healthcare system and wanting to help people. And we knew where the healthcare system could go one day in the future. And it was buying into that idea that what sold me.
And I think that, at the beginning, it really was just an idea, and we started out with telemedicine software being licensed. Our second product, the diabetes prevention program, and now our third product, COVID MD. And obviously it becomes less risky over time because the company builds a product and it grows its revenue. But I think certain physicians are, maybe, they're more conservative or they're not as a risk-taking kind of investor. But like Ari was one of the first group that, decided to, invest even before a venture capital firm would invest, right? I think that in many ways, physicians are more innovative than a venture capital firm, and because they understand the vision for the product and how it relates to healthcare more so than a venture capitalist would, because venture capitalists are not practicing medicine every day.
So, Ari, I'm really interested. What are some of the benefits from you, like being a physician investor? It's such a fascinating concept. So what's some of the advantages, do you think?
The main advantages are, as a physician, I know myself firsthand the downfall right now. Like someone in a bank or venture capitalist, they don't understand medicine. They haven't seen it firsthand. I myself know everything firsthand, and I know if I can fix it myself, just myself, what I would want fixed. And now it's really exciting because I'm basically putting my own money and working with a team to fix all the things that I want fixed in the healthcare system. And to me, that's really exciting.
And I think that like I can't do it individually because, I'm not a doctor. I'm not a software engineer, right? There's this whole company. I think a lot of physicians join because, sure, they could invest $100,000 or even $500,000, but that's not enough to have a company. So instead we have, 300 physicians that invested $20 million and they serve on this advisory board. And it's this combination of, doctors with software developers, with business people, with marketing people, with legal, that forms a company. And so I think that's why a lot of these entrepreneurial physicians get involved. They want to be part of something bigger that's going to have a big impact rather than just, having a small medical practice where maybe they do something innovative, but they want to do a big scale change.
All right, guys, here's a real question. Like we all know the phrase, too many cooks in the kitchen. Is there ever too many surgeons in the surgery room? Like having hundreds of physician investors in one company, there must be a lot of noise. Like this doctor wants this sort of wording on the website. This physician wants such and such functionality in the app. Talk to us about the difficulties of that.
Yeah. I mean, I think that we have this discussion forum called Basecamp where they post all their ideas. So why would you ask, one person for their idea when you could ask hundreds? I mean, there's even platforms where they'll put out, companies like Salesforce will put out they call it like a bug bounty. Like, here's $10,000 to anybody that finds a security flaw. Or they'll do this with like pharmaceutical research, where if someone comes up with like some sort of chemistry idea, they'll give them $100,000, right? Or things like the X Prize. So why would you have one person work on an idea when you could have hundreds? But I mean, I have full voting control of the company. So at the end of the day, every ship has one captain. It's kind of my philosophy. But you want to get input from everyone. So I don't know if you want to add to that, Ari.
Yeah, I think we have I've met and just heard from the most brilliant minds in medicine since I got into Fruit Street. And it's amazing to see the input that everyone has and to be able to take all those minds and put them together. And it's not about taking every little bit and piece. It's about taking all of it and conglomerating it together to make the best product. And it takes time and effort, but it gets there eventually.
Mm-hmm. Yeah. And I mean, we have doctors who have, worked at NIH, CDC, FDA, Harvard Medical School, Mayo Clinic, Stanford. I mean, how could you possibly not want input from them instead of a venture capital firm, right? I mean, it's some of the top physicians out there.
Well, probably because a lot of entrepreneurs don't really want input. I think a lot of entrepreneurs, they have this huge idea that they, want to get funded and stuff, but I think there's probably a little bit of ego that has to be set to the side of saying, hey, I don't want to be the smartest person in the room. Have you seen that be a part of it, Laurence?
Yeah, sure. I mean, other entrepreneurs look at what I'm doing and I think I'm crazy because I'll have like a disagreement with a shareholder in front of 600 people. But it's fine because it's transparent, right? And you have to be willing to be that transparent. And sometimes it's uncomfortable, right? Somebody might post something in front of 600 doctors. It's not appropriate. But it's transparent in that way. So it also saves a lot of time where you don't have to necessarily do these massive formal updates of investors every quarter because you're updating them every day and kind of like these little tweet style posts or Basecamp style posts. But yeah, I mean, you have to be coachable. If you're not coachable and you're combative and you're defensive every time someone has a piece of constructive criticism, it's not going to work, right?
Yeah. Why are you an investor in Fruit Street? Like, I know, is it the same motivation of when people, try and find their unicorn of a business investment where, I hope that I give $100,000 and I get 10 million back? Or like, give us some context into your motivations behind investing.
I fully believe this is the future of medicine. I am, you couldn't convince me otherwise. Because the current healthcare system is just broken. I mean, people don't have access to healthcare. There aren't enough doctors. There aren't enough specialists. The insurance system is all messed up. I mean, I can go through 1,000 different problems. But basically, we need to find a better way for people to access good quality care. And if people can get access to every specialist, be monitored, we can do chronic care management, we can prevent diabetes, and we can do all this from the comfort of your home in the future for anyone, paid for by insurance, where people don't have to pay out of pocket. We just changed the healthcare system forever. And I know that's the future of medicine. I know that's where we need to go. And Laurence saw that years ago, and I understood that. All he did was take a smaller idea and now grow into a much, much bigger idea. And we've all bought in.
Well, yeah, I mean, having hundreds of physicians involved is, makes it easier, right? I mean, why not have 500 physicians invest $100,000 and raise $50 million rather than having one, venture capital firm? So we make it more of like this grassroots effort of physicians that want to have a social impact in public health using technology, which is really what healthcare is about. I mean, one of the problems with venture capital firms is they want to make it as profitable as possible. Well, typically making healthcare profitable means you're also causing a problem, which means that it's more expensive for patients. It's more expensive for the whole healthcare system. So that's why I think venture capital doesn't really align well with healthcare.
So I just want to introduce a concept. There must be like powerful players that are preventing telehealth, from being successful, being adopted by millions of Americans who could benefit from it. So a parallel first, the National Rifle Association, doesn't want certain gun safety laws to be enacted. And so they're a powerful group that prevents that from happening. Is there an equivalent group that is opposing telehealth Like, I don't mean this to be a weird, loaded question, but what are the forces that you're fighting against that are against it?
Yeah, I mean, it's not quite the same in the sense that a lot of support for telemedicine is bipartisan because Republicans are from rural states where they really need telemedicine, and then Democrats just kind of like everything that increases access to healthcare. So it has some bipartisan support, but Medicare has been resistant to pay for it for a while. I'm not sure exactly why. So like they will make it difficult for a doctor to contract with them to be a telemedicine provider. So they'll say, if I approach them, or let's not say me, but let's say I have a small doctor's office approaches them and say I want to be in the network as a telemedicine provider, they'll say no. We have Teledoc, we have MD Live, right? But there are these regulations called any provider statute where they have to allow anyone that's willing to provide the service into the network, and they're not really following that rule. So we might be starting a major lawsuit around that to try to change the rule, but we'll see what happens.
Yeah, this is all fascinating, and again, it's going to be fun to see how this continues to evolve, and it's pretty incredible the pace that Fruit Street is innovating. So, thanks so much, Ari, for joining us today. I really appreciate you sharing some of your experience and some of your ideas with us.
Thanks a lot for having me. I really appreciate it.
Thanks, Doctor. Thanks, Laurence.
We'll talk soon.